So welcome everyone. Thank you for joining us. Welcome to our YWCA Rock County Spring Lunch and Learn. We are so excited to have Ms. Tia Murray present with us today. While we are having our conversation, I ask that you please keep your camera off and then invite you to definitely turn your camera on when we open the discussion for questions from our audience. Today, we will be discussing dismantling racial health disparities in maternal and child health. And I can't wait to jump in. So if questions come to you while we're having our discussion, please do go ahead and put those in the chat. At the end, I will open the discussion for audience members to absolutely join in. And at that time, you can unmute or place your question in the chat and I'll read that. So, Ms. Murray, thank you so much for agreeing to join us. I was so excited when I saw about the partnership with Harambe Village Doulas and Rock County, and definitely wanted to have a conversation with you. YWCA partnered with Kids Forward to create the Race to Equity report. And one of those 4 sections, which we're going to delve into today, is health. And health outcomes and the disparities for mothers of color was highlighted in the report. Low birth weights to babies born to Black mothers was also highlighted in the report. And the importance of having a doula to support. But many in our community may not be familiar with what doulas do and don't do, what the process of selecting a doula and partnering with one looks like. So again, I'm so excited to have you here for this discussion. So my first question is, the word doula means woman helper. And when someone is looking to partner with a doula, I would think it's because labor can be more difficult than you think. I learned that the hard way. Your partner might need help. I experienced a little bit of that, although my partner was really supportive during the delivery of both of our children. And you may need postpartum support, but what things am I not thinking about when you're looking at potentially working with a doula?
That's such a great question. And this idea of having a doula goes back across centuries and cultures, times, and geographies. We've always had somebody's sort of acting in that role of supporting birthing folks as they're bringing new life into this world. And so for all the reasons you mentioned, and then some, so, oftentimes in these days, when we think about doula work sort of on a mainstream level, it's really seen as this sort of add-on luxury service, right? But one thing we really believe at Harambe Village Doulas is doing our work through a community-based doula lens, because we really feel like we can have much more of an impact on many outcomes, on health inequities, for example, and birth equity. But yes, partners need doulas too, right? Oftentimes we assume that our husbands, partners, fathers sort of are just equipped with the skills to support a laboring person. And so oftentimes doulas are filling in those gaps. So one, that fathers and partners are seen, right, and heard, and that they're part of the care. But that two, they're also supported along that journey prenatally, as well as during childbirth and also in the postpartum period. And then also, when we think about medical care, oftentimes our social and emotional needs are sort of left out of the picture. And so doulas really fill in those gaps to really support all of the other things that are happening, right, in somebody's life, especially during such a precious and sacred time as a pregnancy. And so doulas really work with birthing folks and their families during their pregnancy, sometimes even before they're getting pregnant, throughout that childbirth and labor experience. So there's something about that continuous support that has been researched that doulas provide. So as a doula, we're the only one that's seeing a birthing person's labor progression from the very beginning all the way to the end, right? Oftentimes doctors come in to just catch the baby, right? There's shift changes, but doulas are really seeing that progression. And so we're really able to meet all of those social emotional needs, informational needs, and educational needs from pregnancy even till the 4th trimester after baby's here.
So you brought up some really interesting points. And one of my questions to follow up was going to be like how soon, and I get it's different for every person, but on average, like how soon could someone start working with a doula? And to hear you say before pregnancy, I had never even considered that. And then the other end of that is how long after does a person or a family work with a doula? What do you see most often?
Yeah, so really you could start working with a doula at any point in your pregnancy. One thing that we love at Harambe Village is to get folks as early on as possible in their pregnancies for several reasons. Um, Doula work is very relationship based. So we're really developing intimate relationships with folks that they probably aren't developing with most of the providers that they see, right? OB visits last maybe 15 minutes, 20, 30 minutes. But our visits with families last about an hour to an hour and a half most often. And we love to get folks as early as possible. But in sort of this mainstream idea of doula work, oftentimes families aren't connecting with doulas till, they're 30 weeks pregnant, 34, 36 weeks pregnant. But we really feel like it's more fruitful to really be with and spend time with families to understand what else is happening in their life. They may have other children, right, that they need support with before we can even talk about the pregnancy. And so to really be able to understand all of those intersectional identities that are in that birthing person in front of us, working with a doula as early as possible in your pregnancy, we really feel improves those outcomes even more so.
I love that you encompass the entire family and as you're saying that, so we have two children and they're 2 years apart. And I distinctly remember my chubby cheeked, adorable little 2-year-old son late in my pregnancy, he pointed, and it was like around Halloween, he pointed to my stomach and he said, "Boo." And I was like, you scared? And he was like, "No, mommy, boo." Like and we didn't know the gender. I'm like, "Oh, this is boo." And he said, "Yes." I said, "Okay, we're gonna roll with it." And I remember the night our daughter was born, good friends of ours brought him up to the hospital and he walked in and he looked at her and he was so proud and he said, "Boo, you got out." Like good job. Like I didn't know how that was gonna happen, but you did it. So I love that the doula services really, it sounds like, has wraparound care and kind of takes in to account the needs of the entire family around a birthing process. So I think that's really beautiful. So my
Absolutely.
next question, so once a doula agrees to work with a patient or to work with a family, are they on call in the later stages of the third trimester? If they have a family situation or emergency, is there a backup? Like how does that work once the birthing process kicks into high gear?
Such a great question. So our doulas work with families prenatally, and we provide a minimum of 3 prenatal visits. And then our primary doula is on call starting at 38 weeks gestation, and they remain on call until the baby decides to meet everybody. And we absolutely do work with backup doulas. And I think one of the other beautiful things about working within a doula agency is that we have a village of doulas who can jump in or back up the backup doula, or really help if there's extenuating circumstances. So absolutely, we're on call 24/7 starting at 38 weeks of anybody's pregnancy, and we remain on call as well as our backup doula until this baby arrives.
I love that you said until the baby's ready to meet everyone, because it's one of those things you can't schedule. So with the relationship building, is it traditional, or is it a regular thing for you, like the backup doulas, to come to those appointments and to do that relation building with the family?
Yes, so it looks different, right, in everybody's doula practice, but at Harambe Village, we really encourage the backup doula to meet the family prenatally. Some doula pairs will sort of share the care 50-50, and so it's a little much more intense, if you will, and intimate. And we also typically have other opportunities and support groups, right? Well, they'll see the doulas they're working with and be able to engage with them in other sort of modalities and ways. And so to continue to build that relationship with their doula team is also something that's able to happen.
Okay, excellent. So how can working with a doula, so in kind of doing some research and for this conversation, I read that working with a doula can reduce cesarean sections. Um, and I think that's amazing, but how does that work?
So I think that's the golden question, Amy, right? So what we do know from the research is that the continuous support, so we don't leave a client's side from active labor until the baby's here, is what has been demonstrated to produce better outcomes, to lessen the length of labor, to lessen the use of pain medication or augmentations to labors, right? Such as, Pitocin and inductions and those sorts of things, and to improve other outcomes like breastfeeding, because we're there to help latch a baby right after the baby comes. And so I think what the research hasn't done is really identify those levers, right, that really lead to those better outcomes. But we know there's something about that continuous support, not only during pregnancy, but also during the childbirth process, that really ultimately leads to better birthing outcomes. And that's been documented in many studies around doula supported births. And so it's really interesting to think about. We definitely see more vaginal births when a doula is present. We see less low birth weight babies, which is interesting, right? Like what is it? Is it the reduction of stress, right? Because they're able to feel safe with someone or trust someone throughout their pregnancy, or they're able to get those health-related social needs met by working with a community-based doula. We see less preterm births. So particularly at Harambe Village, we're seeing our babies carried to full term. And so it's really interesting. And I wish we could do a little bit of a better job with the research to really identify like what is happening. And you could probably ask a lot of our doulas and they would have answers for you, but it's interesting. The research definitely does document less C-sections, less use of pain management and shorter labors among a myriad of other infant and maternal outcomes.
How much of that do you think is one, that safe connection? I would imagine that's incredibly important, but the advocacy for having someone, um, my husband and I are both pretty reasonable, pretty steady people. And it's just something about the process of giving birth. For example, I didn't ask for any pain medication. And it wasn't that I was opposed to it. I just didn't think of it. There was so much going on. And then later as I said, well, why didn't you ask for something for me? And he said, well, you were doing so well. I didn't think you needed anything. And I'm like, oh, that might have been nice. But, so to have that person that's involved, but not necessarily immersed, that can kind of be the level head and take you back to remember this is your plan, or this is what we talked about before, and to really do that advocacy work because they're in it, but they're not really in it.
Mm-hmm.
How important do you think that is?
Super critical, Amy. And, that's one of the beautiful things about doulas is that we understand the physiological aspects of pregnancy, childbirth, and labor, right? And when we, as birthing people, are in the midst of childbirth and labor, we're using a different part of our brain. It's the laboring brain. So we are there, right? But we're not there. And as doulas, we don't speak for our clients and patients, but what we do is create safe spaces that we're able to empower them and their support person, if there is somebody there, to again remind them, to give them options, to sort of pause if there isn't an emergency, and really help clients understand their ability to make informed choices, or like you mentioned, to understand that there are options, right? Oftentimes we're so entangled in the medical system and it's very much about going through the motions, right? They're just doing their job. But I think sometimes we forget that there's a human being bringing life these are lifetime memories, or sometimes traumatic memories that, they will carry with them for the rest of their lives. And so doulas, even just the presence of a doula has been documented to improve outcomes, because it kind of puts everybody on pause, right? Including the medical team, so that we really can work together and facilitate those relationships needed so that the birthing person, as you mentioned, can understand what options are available and what are my choices, whether it's prenatally or in the midst of childbirth.
Right. And I love that you said the doula doesn't speak for the birthing person, but to kind of re-educate them, remind them that they have options, etc. Yeah, I was looking through the Radical Doula Guide. And that was one of the things that I loved. It's like the doulas don't tell the patient what they should do, or how they should do things, but just to consistently bring in that education piece, and then the advocacy work, I think, is great. So in preparing for this, and I'm a little surprised that I didn't know this, because like I said, I am a mother of two, but Apgar Scores, I didn't know that was a thing until I was preparing for this conversation. And now I kind of want to go back and I wonder what my children's Apgar Scores were. But so I read that Apgar Scores are higher with birthing people who use doulas. And if anyone else like I isn't familiar, your Apgar score, and correct me if I'm wrong, Tia, the quick test that's taken 1 minute and 5 minutes after birth. And it looks at your breathing effort, heart rate, muscle tone, reflexes, skin color, and gives you a score of 0, 1, or 2. So I think that it's probably some of the things that we discussed, like full-term babies, seeing less of low birth weight babies. But are there other things that we haven't discussed that could help improve your child's Apgar score with partnering with a doula?
Yeah, it's such an interesting connection, right? How is it that a baby's Apgar scores are much better when a doula is present during a pregnancy and a birth, right? We're not only impacting the birthing person, but we're impacting infant outcomes. And so again, going back to that continuous support during labor, when we see less medications used, less epidurals, right, that interfere with the baby's physiological processes, shorter labors, less traumatic labors, reducing that stress, right? Doulas really work to bring the bad hormones down during labor and bring the good hormones up, right? And all of that has an impact on baby's ability to function in every system, from respiratory, et cetera. In addition, we also see a lot more skin to skin happening when doulas are present, which we know helps regulate respiration and all sorts of other things. And so, it's a connection that most folks wouldn't make, right? But when we think about giving babies that best start at life we possibly can, when we're assessing that at 1 minute and 5 minutes, what doulas are doing in the room and what they're able to empower birthing people to do can absolutely impact those infant outcomes even immediately after birth. And even something like breastfeeding, right? We see increased breastfeeding initiation rates, and then of course their ability to continue breastfeeding successfully when doulas are present. So there's lots of interesting connections, right, that doulas are able to impact for 2 generations.
That's great. And I'm thinking about people who go through pregnancy and a birthing process without the involvement of the doula. There's like the class that you can take if you plan to deliver at the hospital. And so you have that, and then there's like the breastfeeding class that you can take. And I think it may be like 1 or 2 sessions. Are you seeing that more hospitals are sharing the news of like options to work with doulas? Is that a partnership that they embrace? Is there hesitancy there? How, and I get every situation is different, but overall, what has that partnership looked like between the birthing person, the doula, and the medical team, if someone is choosing to deliver in a hospital or a birthing center, et cetera? And then what, if any, are some of the hesitations of having that expanded partnership?
Yeah, that's a great question. And of course, very different depending on where we're talking about. Place matters. So geographically, things are so different across the state of Wisconsin. But in theory, I think the medical system is really tapping into the notion of doula supported births. And we are hearing um, more conversations from the medical system, from local hospitals, in talking with clients about doulas, but it's also very provider specific, right? And then we have what's in theory, and then we have what's in practice, right? So we want to say yay to doulas, but the problem is that we don't have insurance companies that will cover the cost of doulas. So those that really need access to doula support the most, or may not even know about it, it's a huge barrier. And so although the healthcare system is buying into this idea of doulas, right, as part of the solution, remember, we're not the silver bullet for improving birth equity, what we fail to do is really fill in the gaps of how does someone get connected to a doula, and then who's going to cover that cost, right? So we're seeing more of an uptick in interest into adding doulas into the scene, but I think oftentimes medical systems want to embed doula work into their systems, which is a bit problematic as well. And so we really have to work collectively to think about how can we support doula work that's happening in the community, and not just refer someone or tell them about doula services, but how can we really put our money where our mouth is also, right? If we really want to improve outcomes and really make doulas accessible to everyone who could really use a doula or who wants a doula.
So if I heard you correctly, and correct me immediately if I got it wrong, that some health systems want to embed doula work in their current system, which in a lot of ways there are gaps, that is problematic. So how important is that community mindset for doula work to these wonderful outcomes that we see when people partner with doulas, and how that can't just be plucked out of this environment and placed in the current medical system and have the same outcomes? What is missing when it's reproduced or put into the current system?
It's such a critical question, and I'm glad you asked. And also, um, reminds me of the partnership that we have with the Rock County Public Health Department. You know, as opposed to sort of trying to start their own doula program, they really looked into the community to see what was already happening as far as community-based doula work, and to really be able to partner with what's happening in the community. So community-based doulas are oftentimes from the very communities that they're serving, right? So we're able to understand that lived experience, and really create that cultural safety, right? As we are community situated and embedded in communities. And what happens when we become part of the medical system? We all know there's a lack of trust, particularly in communities of color. And what we've seen, especially with the history of midwifery work, right, is that it has been erased in the community and really medicalized and embedded in the medical system. And so now we have less midwives of color, right? More infant mortality, more maternal mortality, because we've taken something out of the community, which we know from the research produces better outcomes, right? Midwifery supported births. And we've embedded it in the medical system, thinking that's the golden standard. And so if you think about even just the history of midwifery care, it's very much similar to what's sort of happening on a political level and a policy level with doula work. Is we're moving towards this idea of licensure and certification and embedding it in a medical system. But what we fail to do is leave that power and autonomy in the community, where we know that community power, right, can really spark true change. And you know, we have to really recognize that there is knowledge in our communities, traditional knowledge. We've been doing this and supporting birthing people for years. And to be honest with you, having a baby isn't medical, right? We treat it we treat it as a disease, right? When people come into the hospital as if we have to treat something. But what we really need to do is support things that have been happening for years and centuries, right? And to really acknowledge that knowledge and lived experience that is situated in communities. And that's where we see the biggest impact in respect to birth outcomes.
I think I'm still processing that having birth is not like a medical situation. It's not something that needs to be treated. Yeah. So you brought up the partnership with Rock County, which I'm so excited about. I'm hearing people talking about it in the community, people that are applying, etc. So share with me, like, what makes a good doula? And this is before any training happens. Like what are the attributes that an individual, besides, a passion for this work, what sets you up to be a good doula?
It's a really great question. And I don't know if I have a particular answer, and it's something that we tell a lot of the doula trainees that we work with is that you are already a great doula. But what we're going to do is give you the space and opportunity to become an amazing doula. And so, some of those traits, if you will, are compassion, empathy, being able to be with, right? Having those lived experiences, whether you've given birth yourself or you lived in the same community that some of these other birthing folks have. And so I think a willingness to be with others in such a vulnerable time can go such a long way. And we have doulas who are teenagers, we have older women, grandparents that want to be doulas. And so there really isn't sort of this, ideal picture of what a doula is. But I think someone who's really able to embrace this concept of community mothering is something that we talk a lot about in our doula training. And so I think anybody willing to sort of step up to the game and work through a reproductive justice framework. So we have lots of doulas, for example, in Dane County, right? But majority of them are white, and it's serving an upper to middle class population. But nobody was really doing that reproductive justice level work to really create access, right? And doing birth work as activism, I think you had mentioned, in Dane County. And so that reproductive justice framework is crucial. And whoever, it doesn't matter what you look like or where you come from, as long as you're willing and able to utilize reproductive justice, not only as a theory, but a praxis, right? A way that you live your life and a way that you do your birth work, is truly at the essence of what a great doula is, in my opinion.
All right. So there was a lot there. Teenage doulas. I never even considered. So I want you to talk more about that, and what that looks like. And reproductive justice work. Tell us more about what that looks like in practice, please.
Absolutely. So just talking about the teen doulas. So we're currently working with a doula that works in the Sun Prairie School District. My daughter, who has been enmeshed in this work for many years, will continue to tell me about young ladies who think they're pregnant or they don't know where to go. And we also work with the SAPAR program, which is in the Madison School District, to connect young teen moms with doulas. And what we're trying to build is a program where these very teens or teen moms can train as doulas themselves to be able to support their peers, right? Those are the doulas who are going to understand other teens or other teen moms the best. We do the same thing with our fatherhood program, right? We want fathers leading that because they understand the lived experience of other fathers. And so we're really trying to create the same thing for our younger women and birthing folks to feel like they see themselves and to be able to work with doulas who really truly understand their lived experiences. And then when we talk about reproductive justice, oftentimes we hear a lot about reproductive rights or this sort of dichotomy of the abortion issue, right? Pro-choice versus, those conversations that we hear. But reproductive justice really takes into account all of the other issues at play that oftentimes Black, Indigenous, and Latinx communities and other communities of color are combating from, young adulthood all the way through the rest of their lives. And so reproductive justice is really about human rights. It's about a universal set of human rights. It's not just about abortion. It's not just about access to contraception. It's about all of the other things that get left out of those conversations, like our ability and right to be parents, and to be able to parent our children absent of judgment, right, and coercion, and sort of the daunting things that come from our systemic injustices and policies, et cetera. And to be able to choose if and when we want to be mothers or parents. And that should be a universal human right. And so reproductive justice brings a bigger contextual picture into the conversation, as opposed to sort of minimizing the reproductive health and reproductive justice life course of all women of color to sort of this idea of contraception or abortion, when there's so much more at play. And this idea of who gets to be a mother and who is a good mother is also very much entangled within this reproductive justice framework. And so creating safe spaces where everyone can see themselves in that picture and feel safe regardless of their choices, that really is at the essence and the heart of a reproductive justice praxis.
That is really helpful. Thank you for that clarity. So I'm a little biased. I actually used to coordinate the SAPAR program for the school district of Beloit. So I hope that there is space carved out in the partnership with Rock County that includes our SAPAR students, and that was for the moms and dads. Yes, so perfect. Talk to me a little bit more about community mothering and what does that look like in action?
I love it. So our work at Harambe Village is very intergenerational. So you mentioned the Race to Equity report. And that was really the impetus in a lot of ways for Harambe Village back in 2014 when the Dane County Race to Equity report came out. And as you know, almost any category we could measure, Black families are not doing well. And we know that infant mortality is a true measure of the health of a community. So oftentimes it's folks in their own communities really stepping up to take care of the issue, if you will. And that's exactly what Harambe Village did. We wanted to do something about the problem instead of continuing to talk about it or put out reports about it. We have to take action. And Harambe really came from a center that used to exist on Madison South Side from about the early 90s to 2010. So 20 years of existence. It was elderly women of color doing work in the community through a one-stop shop model that actually impacted the Black preterm and low birth weight outcomes. We actually saw the deepest decline in the early 2000s that we've ever seen in Dane County. And so what we know, they studied it, right? They looked at all the medical advancements, but what they didn't look at was that community mothering that was happening on the ground to support families to be the healthiest families they could be. And this is something we've always done in the Black community in particular. If you think about granny midwives, at one point in this country, granny midwives caught everybody's babies. And the midwife was really seen as this healer, this caretaker, this community mother who would go and see sick folks or go, walk miles to catch everybody's babies. And that isn't something that has left the heart of the work that we do in our communities, particularly as women of color. And so we wanted to build on the work that our elders had done in this community, and we're still working with them. They're still standing 50 years later, and we're learning from their generations of work, and we're carrying on that baton, and then also reaching back right into our own communities, right, through the teams, through training folks from the very communities that we're serving to carry on the work. And that community mothering will sustain that work for years to come. And that community mothering is where we see the most impact happening as well on a really grassroots level that I think oftentimes is hard to measure.
So when the way you just described community mothering, remind like when my babies, which they're really big babies now, they're 13 and 11. But when they were younger, I was a stay-at-home mom and I was a part of Mocha Moms. And sometimes just that a space just to be around other women with children around the same age as your, even if we just took them to the park or to a story time or whatever, sometimes that is the thing that kind of like saved the day. Mothering is amazing. It can be a lot. So when you talk about community mothering, are you finding that the birthing people that you're working with, that they have or are building community with, do they know each other? Are they building community with each other? What does that look like?
They absolutely are. And oftentimes, a lot of the mothers we serve want to go on to become doulas themselves, or maybe to become midwives or nurses because of their experience working with a doula. And we, of course, pre-pandemic, we're able to create lots of opportunities like dinner with the doulas every first Wednesday of the month, where moms would come, old clients, new clients, future clients. We were holding each other's babies, that peer support. We were cooking healthy meals and learning things without learning things, right? Learning from each other. And we know that there are impacts that peer support can have, right? Outside of the medical system, for example. And that is what we're seeing happening. We've tried to recreate that in a virtual world, which has been a little more challenging, but we've seen that happen with our monthly support group that we have. And it's really beautiful to not only see the connections among doulas, because they're also oftentimes mothers and parents and birthing folks, but that connection between the mothers and the parents that we're serving, and being able to learn from each other and lean on each other and share information with each other is such a beautiful thing that we need to create more safe spaces in our communities for those things to happen. And as a mother of 5, I can absolutely relate to what you're saying, Amy. To have those safe spaces. And it was the African American Breastfeeding Alliance for me in Dane County that, as an 18-year-old mother who planned my pregnancy and wanted to breastfeed, there was really nowhere for me to go where I saw someone that looked like me or felt, welcomed in a space, or saw even my peers breastfeeding their babies. And so that changed my life. And I was able to breastfeed my son for 2 years, and then, go on and share that with my peers as they began having more children. So, that can be so critical in someone's, parenting trajectory, that we need more of those safe spaces.
Absolutely. And just someone to tell you, you're doing this well, means the world. You've mentioned a couple times midwives. Can you explain to us the difference between a doula and a midwife?
Of course, this is probably one of the most common questions that we get. So midwives are actually medical providers. Of course, you have certified nurse midwives who oftentimes you will see working within the medical system. But we have certified professional midwives, which, and I don't like this term very much, oftentimes they'll be referred to as lay midwives, but CPM, certified professional midwives, are oftentimes doing community midwifery work. And so they're doing home births, or they're working out of birth centers. And some certified nurse midwives will also work in the community and do home births and birth center births. But most oftentimes you'll see certified nurse midwives embedded in our hospitals. And we know that midwives and doulas, when they're supporting pregnancies, we see very similar outcomes, which is quite fascinating. But doulas don't do anything medical per se, right? We're not taking blood pressures. We're not, doing any exams. We're really supporting all of the other things that fall outside of the medical scope of work. And right now, I'm a midwifery student myself, and so it's just really fascinating to learn that medical perspective around that mother-centered model of supporting pregnant folks is really at the heart of midwifery work. And we know that when we have more birth centers in communities where midwives are present, and we have more midwives of color in communities, we see better birth outcomes and better birth equity.
So you just said mother-centered model. What other model is there? So maybe that question seems kind of odd. Like it's interesting to me that there's a specific name, like mother-centered model. If you weren't using that, like, is there anything else? Okay, I think you're back. So my question, let me repeat. You mentioned mother-centered model, which kind of sounds crazy to me to say that, because isn't that the only model?
That's such a great question. I've never heard anybody sort of put it into that perspective, but no, there really isn't. I think there's the medical model, and then there's really that person-centered, mother-centered, if you will, birthing person-centered model, where we don't get so caught up in the medical aspect of things and really truly believe in the body's ability to give birth, right? We know that almost all low-risk pregnancies can birth outside of a hospital setting safely. We know that under 5% of babies need a little extra help when they're born. And so it's actually safer, according to a lot of the research globally, to birth in a birth center or birth in a community setting. And it's actually been documented that our obstetrical model, particularly here in the United States, creates more harm in respect to birth outcomes, which is fascinating to think about, right? And we live in a country that has some of the most advanced healthcare, but yet we live in a country that has one of the highest maternal mortality rates right here in the United States than other lower resource countries. So if you think about that, that doesn't really make sense. But what's happened is over the years, as we've seen the rise of the medical institution, and we know that Dr. Marion Sims is seen as the godfather of obstetrics, but his work was built off of experimenting on the bodies of Black enslaved women. And so there's so much entanglement between our medical system, right? And racism, et cetera, that our current obstetrical model actually creates more harm, particularly for birthing folks of color, than if they were to birth in a community or midwifery setting. And that's been documented globally.
So what work do you and people who are engaged in work similar to Harambe Village doulas do to let people, just that community education? The community education to let people know that and to know their options. And I know it's difficult because you do so much, but what intentional work around education does Harambe Village doulas do, and not just for like the clients or the patients that you're working with, but just community education?
It's a great question. So really a lot of what we do is just share information, right? Folks don't know that they have options about how we birth our babies, how we birth and where we receive our care. And of course, we have the barriers of insurance coverage and where we can go, which is problematic, and that needs to be changed. And there's some advocacy work we've been doing around that, particularly with Medicaid. But oftentimes it's about just sitting down and having a conversation, and folks don't really realize that there are a lot of options when we think about receiving obstetrical or prenatal, perinatal care. And I think we have this sort of tunnel vision idea of, oh, we just go to the OB's office and we kind of just take what we can get. And no, you can change your providers. No, you can see a midwife in the community and see an OB at the same time. Or you can have a home birth safely, granted you have a low risk pregnancy. So there's so many options that we not only are sharing information with families about, but we're doing that community level advocacy work so that others involved in this work in the healthcare system, policymakers, are also working to create those policy and systems changes that we need to go hand in hand with really giving birthing folks that autonomy and choice as to where and how they receive their care or birth their babies. And one other thing we're working on at Harambe is the opening of our Harambe Birth and Family Center. So
what can people who are listening right now or who will watch this recording, what can community members watching do to support the work at Harambe Village, and to support the upcoming partnership with Harambe Village Doulas and Rock County?
Yeah, many things. I think, of course, you can always donate to our crowdfunding campaign. I can share that link in the chat box, which will support the Harambe Birth and Family Center that you may have heard about before I got disconnected. But really raising awareness about not only inequities in birth outcomes, because you'll be surprised that we continue to talk to folks who just don't know that this is a problem in our own backyards. So raising awareness about birth equity, inequities in maternal and child health, particularly for BIPOC communities, but also learning about and raising awareness about doula work, particularly community-based doula work. And that's one of the things that I really love about Rock County's approach, is that they not only wanted to work with a community partner who's already embedded in the work and to support them as experts in the work to help raise that community level awareness, right, that we need to really go hand in hand with also providing access to community-based doula work. So it's about providing access, low to no cost access, right? And raising that community level awareness, not only for birthing people, right? Sometimes we don't even know a doula is an option. What's a doula? But they understand the concept of it, right? Once we're able to talk more about it and educate folks about it. But not only birthing folks, about public health folks and those who are involved in this work, like yourself, Amy, to really understand what it means to have access to doulas in our community. And so raising that awareness, educating folks, and of course, supporting initiatives happening in communities. And like Rock County is doing, is supporting the expansion of initiatives so that Rock County can also benefit and recruit and retain and train their very own doulas, right, to do the work. So, those are a few examples of ways that folks can support this work and that of community-based doulas in Rock County.
So I know Jean has to leave soon. Hopefully she's still here. So I want to try to get her question answered before she heads out. It says, what can we do to get this wonderful opportunity added to the excellent work that HealthNet does in our community? So if I'm a community member and I hear about this wonderful partnership, but I have some kind of connection with SSM Health or Beloit Health Systems or HealthNet, how do I connect these pieces to see, like, how do you get a partnership like this started? What does that look like?
It's a really great question. And I think that is something that Rock County and Harambe Village are working on right now, is to sort of set an example and a framework of how we can partner in this effort and bring others along. And I really think it's about starting those conversations, right? It has to start somewhere. And again, not only starting the conversations, but looking around to see what other work is already being done and partnering in that, as opposed to something that we're really good at in Dane County is recreating the wheel, right? We don't need to start something new, shiny, and fancy. Let's build off of work already being done in the community. And so sometimes that takes really getting into the community or permeating those medical spaces, like you mentioned, like SSM Health or other networks, to begin to have those conversations and encourage folks to come outside of those medical walls to really, truly, embrace this essence of it takes a village, right, to raise a healthy baby. And so the more we can make those connections and create those relationships and partnerships, I think we're going to see better impact and better outcomes.
Perfect. Ms. Sloan, I see you have your hand up. Please go ahead and unmute.
Yeah, thanks, Amy. Hi, Ms. Murray. I wanted to kind of react to Jean's question because more than 10 years ago, my sister, Marilyn Kilgore, started this entire program in Rock County. Doulas were being identified and trained. There was a lot of, it was on a regional basis, Milwaukee, well, county, I'll say Milwaukee, Racine, Rock County, and Ian was actually a part of her team that worked on this situation. And unfortunately, my sister passed away and there was no one to pick up the ball, but we were doing this more than 10 years ago. But I also wanted to say one thing. I've really enjoyed listening to you speak about this. There is a show, a series on Showtime, and you may have watched it, but during that 4th season, they actually had Doula's birthing one of the young women, she had a baby on the show. And that whole experience, because I had never seen it in that manner, but it almost transported me right into the room, the spiritual environment, the singing, the clapping of hands, and helping the mother continue to breathe until that baby was born into that big tub of water. It was just beautiful. So if you get a chance, watch that 4th season of, it's called The Shy, and it's on Showtime. So I just wanted to say that, but also share that about my sister and the work that she was doing way ahead of this time, and appreciate you. Oh, I'm sorry. Are you connected with the Black Women's Health, what's her name? Lisa, up there, that has the Black Women's Health Center as well?
Yes, so we're aware of the Black Women's Health Foundation, and
Yes.
They're doing some work with the Dane County Health Council, but it's very much embedded in systems.
Okay.
But we're working and collaborating as much as possible.
Okay.
We've been doing this work for 8 years, and they're just
Absolutely.
now sort of getting into the.
I know.
And so I hear you, Ms. Wanda, and I appreciate your comments and would hope that we can build off of the work that your sister has done, and that it sounds like you might still be involved in. And so please, I hope we can get connected to you, particularly through the Rock County project, because like you said, the work was already being done. And so we should really be building off of that in any way that we can. So I appreciate
you as well. Thank you.
Ms. Sloan, thank you for your comments. Thank you for reminding us of the work that your sister, Ms. Marilyn Kilgore, worked on for years. And we definitely want to speak her name and lift her up as a reminder of this foundational work that has already been done in Rock County. So thank you for that. Steve, I see that your hand is up. Please go ahead and unmute, join the conversation.
Yeah, just want to follow up on Wanda's comment. Marilyn Kilgore was just a dear person to me, who those of us who were working on that Beloit Life Care initiative on healthy families. I'm forgetting the exact name of it, but that ended up going defunct, and largely because of Marilyn passing away, that we didn't have quite the energy to hold it together. It is good to see some of those justice issues and everything being revisited, coming up again, being pushed. It is amazing how hard it is to get people to pay attention to that and realize it would be great to see some metrics put in place of, are we making progress on that or aren't we? And if we're not, what are we doing wrong? And let's change some of the things. But very much appreciate your work. Thank you.
And I see in the chat, Kylie put a question, which you've addressed a little bit, Tia, with prenatal appointments and once in the hospital setting of labor, how do you see medical staff and doula relationship, along with the patient interaction between both medical staff and doula? So if there's anything you want to add to that.
Sure. It ranges, right? I've been at births in Beloit or Janesville, and then, of course, been at many births in Dane County, and it's very different depending on the environment. And I think one thing we've tried to do, particularly in Dane County at Harambe Village, is create relationships with our largest birthing hospitals. And although it's taken many years to really get into the space, to develop those relationships, to be seen and to be heard and to be taken seriously, that work has gone a long way. So now when they see a Harambe Village doula come into the space, they're like, oh, it's a Harambe Village doula, and so whereas before it was a little more combative, right? Like, oh, there's a doula here, why are they in our space? But even when that happened, oftentimes at the end of the day, after that baby had arrived, they were thanking us. We were now close to the nurses and to the staff, and they realized the power of having doulas in the room. And so, it can really range, right? Prenatally is a whole nother ball game, depending on how providers see doulas, particularly doulas of color, right? There isn't just issues between patients of color and that of our healthcare staff, but when doulas of color walk into the space, that's also very different when we don't see people that look like us. So it can really range. Some providers are really bought into the idea of doulas, and others are kind of like, what's she here for? Or what's he here for? But when we can really create those spaces to facilitate relationships, we see that narrative shifting.
As a part of the partnership with Rock County, is that kind of cultural competency piece, unconscious bias training for providers, are there discussions to have that as a part of the partnership?
I do think that's on the table. We're just getting into the project, but we do have a representative from SSM Health, a regional representative. So we have that voice at the table so that we can really be interdisciplinary, right? And really affect all of the levels of change that have to happen, right? And this is something we learned really early on in our grassroots level work, is we were like, oh, we can get doulas working in the communities and get good outcomes, but we're not changing the systems and the policies that have to happen so that we can really combat and dismantle the inequities collectively. And so I think there is opportunity for that to happen with the Rock County project because of the players that are involved, from the university to public health to SSM Health. And then we have the doula community group as well. So I appreciate that question, because all of those are necessary ingredients, right? We can't just have one without the other. And what I would also love to see is to get payers at the table, because we need folks to cover the cost of doulas doing the work. We can pay for that with grant funds, but how do we sustain that, right, over time is also a critical, important factor to consider.
Right. So as we're closing, could you kind of say, what is the financial commitment to working with a doula? And I understand it's probably on a sliding fee because access is important. And also, what does the training process, what does that look like if I'm interested in becoming a doula?
Such a good question. It ranges, Amy, depending on where you are. It's hard to find access to doula trainings. One reason why Harambe Village started their Madison Doulas of Color initiative in 2014. So we've trained over 70 doulas now. We used to scholarship them to attend a local DONA trainer. But the feedback we were receiving is that the trainers didn't look like them, and they still felt like they were missing pieces of that community-based doula work, right? And then how do we do this doula work for those that can't afford to pay and still sustain ourselves? And so that's why Harambe Village created their own training so that we could increase access to folks that really want to work in a space that offers a sliding scale fee, et cetera, because doula services in our area can range from $500 to $5,000, depending on which doula practice you work with. But one of the things that we've done at Harambe Village is create a model so that anybody who needs access to doula services, their services are covered. And that doula will also be compensated at a livable wage to provide those services. And so it's a unique model. It's something that a lot of communities are trying to figure out. And we were even told early on that if you make doula work free, then you're really doing a disservice to doula work, but I would beg to differ. And we have never had to turn anybody away. And so to answer your question, the price ranges, and we need to create more equitable opportunities for folks to access doula training, such as what we're trying to do through the Rock County Initiative, so that we can really expand access and train more doulas to serve more communities.
I wonder if the perspective of whoever shared that with you is if because it's a difference in if the patient's not paying and if the doula's not getting paid. And I'm hoping the perspective of if you ask doulas to provide their services for free, you're doing a disservice, and not the reverse of if the patient or the if the person receiving the services is not paying. I could talk to you for another hour plus. I am going to extend the offer. We also do YWCA Rock County in partnership with Community Action and with Diversity Action Team. We do monthly courageous conversations. You, Ms. Tia Murray, have an open invitation anytime you want to do a courageous conversation, maybe further along in the partnership with Rock County. Please, you just send me an email or call me and we will get it scheduled. If there's ever information you want to get out or to provide additional information, and I definitely, I want to hear more about the Harambe Birth Center and what your plans and dreams are for that. So please don't be a stranger. If you ever want a platform to speak to Rock County, again, these sessions are recorded and then posted on our YouTube channel. Please don't hesitate to reach out. It has been a pleasure. Thank you so much for your time. I'm so excited about this partnership with Rock County. And if there's anything that YWCA Rock County can do to advance this partnership, to support it, please do let me know.
Thank you. Thank you so much. And thanks to all of you for being here and spending an hour of your time with us today. Please do reach out. I put my email in the chat box. Thanks again, Amy.
Perfect. Thank you. Take care.